Hey guys, welcome to AllDrugNews' first official newscast. First, we have an update in terms of where various cannabis legalization measures stand in different states across the country. As of now, Montana, New Jersey, and South Dakota have secured voting referendums on recreational cannabis legalization in the upcoming election. The state of Mississippi will vote on two competing proposals to create a medicinal cannabis program, and Oregonians will vote on whether to decriminalize low-level possession of all drugs and invest in cannabis sales tax revenue into addiction treatment programs. Separately, Oregon's ballot will also feature a referendum on whether to legalize psilocybin for therapeutic purposes. Arizona and Nebraska are awaiting third-party verification rulings to determine whether they gathered enough valid signatures to place legalization measures on their ballots. And Oklahoma was granted a 90-day extension ending in August to collect enough signatures after being denied the right to collect signatures electronically during stay-at-home orders. This comes as the Democratic National Committee released its initial draft of its 2020 Democratic Party platform last Thursday, and it echoes presumptive nominee Joe Biden's original stance on cannabis policy. While both the DNC and nominee Biden stopped short of legalizing cannabis recreationally on the federal level, it is supportive of states having the autonomy to decriminalize and or legalize cannabis at their own discretion. One significant change is that Biden does endorse descheduling cannabis from a Schedule I to Schedule II narcotic designation under the Controlled Substances Act, which removes barriers for conducting cannabis research, including the need for labs to obtain DEA approval. He also supports investing in research for chronic pain alternatives through the National Institute of Health's HEAL initiative, and automatic expungements of cannabis-related arrests and convictions. While the DNC and presumptive nominee Joe Biden do not necessarily support legalizing recreational cannabis federally at this point, congressional leaders, including Representative Gerard Nadler and Senator Kamala Harris, are pushing for Congress to vote on the MORE Act by September. The MORE Act proposal has 76 signed co-sponsors, including Senator Cory Booker. It would effectively legalize recreational cannabis if passed, since a key component of this legislation includes removing cannabis off of the controlled substances list entirely. It also calls for using 5% of sales revenue to create an opportunity trust fund that seeks to reinvest in low-income communities and individuals impacted on the war on drugs, and to create review boards and programs designed to expedite cannabis business licenses and waive fees to individuals with prior cannabis-related convictions and whose income is less than 250% of the federal poverty level. Lastly, the proposal calls for federal courts to comprehensively review prior cannabis convictions, encourage expungements, and for past offenses to be treated, quote-unquote, as if it never occurred. In shifting gears, let's talk about a few updates on the current overdose crisis in America. Last week, the Food and Drug Administration issued new recommendations that advise doctors to discuss and prescribe Narcan/naloxone for patients who are being prescribed opioid painkillers, especially those patients with histories of opioid misuse or with opioid use disorders, and who are currently taking other medications, including benzodiazepines, methadone, and buprenorphine. The FDA also now requires labeling on opioid painkillers describing treatment for opioid use disorder or addiction to be updated to recommend the joint prescription of naloxone along with opioid treatments. A study of referrals made from Boston Medical Center among those who entered for an opioid overdose shows that the vast majority of post-acute medical facilities to whom the referrals were issued rejected requests to provide medical care. At least 15% of the rejections among patients with substance use disorders were denied due to having an SUD diagnosis or because they were being treated for opioid use disorder with buprenorphine or methadone to begin with. This is in despite of Massachusetts Department of Public Health issuing relevant guidance to post-acute care facilities and stated that individuals taking buprenorphine or methadone to treat opioid use disorder who were eligible for admission could not be denied due to having an opioid use disorder or using medication for it. Specifically this weekend, in zeroing in on Connecticut, city officials are reporting a spike in overdoses in New Haven and in greater New Haven region, which experienced 21 overdose calls within a 24-hour period. Officials believe that the overdoses are from heroin that are laced with fentanyl. Interestingly, though, there are no fatalities. And we do have an update regarding legislation surrounding psychedelics. Activists for Decriminalize Nature DC announced that DC watchdog officials determined that the petition to decriminalize psychedelics collected enough valid signatures for the measure to be featured on its November ballot. The organization submitted approximately 35,000 signatures against the 24,712 signature requirement. While Initiative 81 does not legalize or reduce penalties themselves for having psychedelic substances, it would require that law enforcement consider crimes regarding possession and cultivation and sales to be among the quote-unquote lowest law enforcement priorities. This would apply to all youthogenic substances, including psilocybin, ayahuasca, ibogaine, and DMT. Lastly, the Trevor Project published its 2020 survey reporting various mental health outcomes among LGBTQIA+ youth in America. The Trevor Project is a nonprofit organization focused on promoting suicide prevention and intervention among LGBTQIA+ youth. The organization released the results of a comprehensive survey taken by 40,001 persons of ages 13 and 24 who identify as LGBTQIA+. 40% of respondents reported having contemplated suicide throughout the past year, along with 48% saying that they engaged in self-harm. Yet 46% also reported being unable to get help from a mental health professional within that time frame. However, one notable and positive finding was that transgender and non-binary youth who reported having pronouns respected by almost all of the people in their lives attempted suicide at half of the rate as those who did not have their pronouns respected, giving data-proven credence to the importance of people both embracing their accepted pronouns and others respecting that their pronouns by which they wish to be addressed. So it definitely is notable that a person being in an environment where their pronouns in which they identify are respected is a significant protective factor against poor mental health outcomes. If you have any questions, comments, or feedback, you can email us directly at alldrugnews@gmail.com or send us a direct message via Instagram at AllDrugNews. Thanks, guys, and stay tuned for the next newscast launching on Thursday night.